For more, let's speak to Cedric Hansen, Vice President of Global Health Security Alliance. Dr. Hansen, thank you for speaking to France 24. It's been 16 long weeks. I'd like to ask you, first of all, in your opinion, was the lifting of the state of emergency, was it long overdue or is it premature?
Well, as you have mentioned at the beginning of your speech, there is a transitory period that is coming up to the end of October. And that tells you that it is not premature to stop, but it is wise not to stop too abruptly. And the fear is that the general population confuse the end of the state of emergency with the end of the pandemic. And actually, the virus is still circulating, and people should remain cautious about the barrier measures and hygiene, hands hygiene, because what tells us the end of the state of emergency now, from the beginning of this day, is that it is no longer the responsibility of the state that you remain healthy. It is now your own responsibility to protect yourself and to protect the others. So it is a drastic change in the mindset of the population. We are now responsible of our own. That's the main change. But the disease is still there. The virus is still circulating. It is still dangerous to think about it as an end and see what happens in other countries where there is no measures to protect the population, where the amount of people infected is dramatically higher than in France.
But why are people perhaps less cautious, wearing masks less often, washing their hands less often? I've spoken to people in the course of daily life who know the virus is present, and yet they are taking less precautions.
It's a question of a perception of the risk. It's well known in disaster medicine that the perception of risk, if it's around you, if your relatives are hit by the disease or the disaster, whatever the disaster, you'll be highly cautious because you feel that you might be involved yourself. But when nobody around you is bothered by the situation, then you feel that you're secure. And what happens is that everybody at the individual point of view consider that the story is over for himself. He is not an arm or a threat for his relatives. Neither are his relatives a threat for himself. So that's his deep feeling. So no need to precaution. The two of us, we can be close. But what happens is if you do that as many times as the population has inhabitants, then you actually spread again the virus among the population. So that's why we still need to bear in mind that we are at the individual level responsible for the collective health state of the population. It's true in France, it's true in Europe, it's true all over the world.
All right, Dr. Hansen, stay with us. I'd like to get your reaction to this next report. With the lifting of the state of emergency, money is expected to dry up that provided temporary housing for thousands of homeless people.
Siaka and his family have been living here for the past 4 months. This hotel was able to house 400 people since the beginning of the lockdown in March.
On est venu ici, on prend soin de nous tous les jours. Température matin, température de soir, pour voir notre santé, sur comment, au dehors, qui va faire ça pour nous?
The hotel, which belongs to a French NGO, was one of the first buildings to be requisitioned by the government to house the less fortunate. For many, it was a welcome change to the living conditions they'd experienced in the past.
Finalement, c'était une chance pour moi. Voilà. Pourquoi? Parce qu'en fait, je suis arrivé dans une structure où avant, là où je devais pleurer, appeler le 115, voir l'assistance sociale, et ainsi de suite. Là, du coup, y a tout qui était réuni dessus, ici. Donc, je suis en train de faire toutes mes démarches pour avoir un hébergement.
But the 4-month-long break is now over. For many of these people, the end of the state of emergency means they will likely be back on the streets.
Je pourrais pas te dire où exactement tu pourrais aller dans quel centre, puisqu'on n'a pas de nouvelles par rapport à ça.
Ilal and his team have until the middle of August to find alternative solutions for everyone.
C'est le stress comme pour eux, comme pour nous. Parce que nous, on voudrait bien en fait, qu'ils retrouvent où dormir après le 15 août. Enfin, comme on dit, on garde la foi et on essaie de faire du mieux qu'on peut.
Last month, the Minister of Housing sent a memo to authorities in Paris calling on them to ensure people aren't back on the streets overnight. Organizations have since been in a race against time, and they hope the emergency housing spots that were opened during the lockdown will remain open in the future.
Dr. Hansen, this pandemic exposed inequalities around the world. Men, women, children who have little to no resources disproportionately affected. Here in France, what measures are in place to safeguard them from the virus?
Well, I'm not a specialist of that field specifically because it is not the field of medicine, but it is of utmost importance that the frailty and the vulnerables be still protected until the virus is no more circulating, because there definitely are the people who may be touched and pay quite a heavy load on that story. It's very difficult for them to access to healthcare system, so it is very important to keep track of them, still take care of their health, monitor their health, and be very sensible about the access to health and protection. But they are part of the people living on the territory. They are part of people. They have French citizen or resident, and we need to protect them. And it is very important because protecting them is protecting us. So this is something to be to be taken care of, definitely.
All right. Thank you very much, Dr. Jan Cedric Hansen.